Great. Well, it is a great pleasure to welcome you all to today's webinar. Thank you so much for taking the time to join this exciting installment of the Nurturing Futures webinar series. My name is Katie Murphy, and I'm thrilled to be opening the session on behalf of the Moving Minds Alliance. I want to take a moment to acknowledge the tremendous work of the Moving Minds Alliance Secretariat, in particular Lola Ayanda, who's with us today, for putting together such an amazing program. I also want to acknowledge the visionary leadership of Tricia Young, the former director of Moving Minds Alliance. I spoke with Tricia yesterday, and she emphasized how excited she was about this session, given the amazing lineup of speakers and experiences. She is deeply missed, but we are grateful for the opportunity to continue this important work and these discussions. The Moving Minds Alliance is a collaborative, multi-stakeholder alliance advocating for early childhood development in every crisis response, leveraging the strengths of diverse actors from the local to the global. We believe in the power of collective action. We bring together donors, implementers, researchers, and advocates to ensure that early childhood development is prioritized in humanitarian and fragile settings. And today's conversation is a great example of that mission in action. But I want to challenge us all today to think about how we can push that mission even further. Many of you here are familiar with these issues, and like me, you share a passion and dedication for advancing outcomes for young children and families in crisis. But as you listen to today's session, featuring expert voices, lived experiences, and practical ideas, I challenge you to consider: what takeaways can you bring to local leaders, policymakers, decision makers, influencers, and others who may not yet be convinced of the power and importance of early childhood initiatives in crisis and conflict? What messages resonate most and can help lead to long-lasting and sustained impact? And to guide us in that conversation, I'd like to welcome an outstanding leader and advocate for children and families in some of the most marginalized and vulnerable settings, a true mover and shaker. Please join me in welcoming Maysa Jalbout. Maysa, over to you.
Thank you so much, Katie, and thank you to the Moving Minds Alliance for hosting this very important webinar series. Today's discussion in particular is very close to my heart, and I feel very, very privileged to be moderating a session amongst speakers who are not only experts in early childhood development, but work in some of the most challenging contexts for children around the world. Very eager to hear what they have to share with us today. And of course, very eager to hear the questions from the participants. I promise to do my best to take as many questions as possible. The Nurturing Future series is a bi-monthly webinar that brings together some of these diverse voices that you're going to hear today. I very much echo what Katie just said, which is this is an opportunity for us to be action-oriented, to share real strategies and insights. We are, it's just a platform for us to connect. And of course, the real action happens in the follow-up. This is the second webinar in this series, and there are a few upcoming episodes, which I encourage you to jot down and sign up for. The dates are on the screen in front of you. Colleagues, in recent years, the number of children affected by humanitarian crises has surged, with millions of young children living in conflict zones, refugee camps, and other emergencies. These circumstances can have severe and long-lasting impacts on children's physical, cognitive, and social emotional development. The critical importance of early childhood interventions is known to all of us, but despite that, the fact is that it remains an extremely underfunded and often an overlooked intervention in humanitarian responses. The Moving Minds Alliance recognizes the urgent need to address this gap and advocates for integrating early childhood development into emergency response efforts. The Alliance works through collaborative advocacy and supportive catalytic change-focused initiatives to promote equitable and dignified access to care for children 0 to 8 years old in crises. We want to get to the speakers as quickly as possible. Just a reminder that today's focus is around beyond survival, remodeling humanitarian response in protracted crisis for early childhood development. As I mentioned, there is a very esteemed group of speakers. I'm going to introduce each one of them separately. We have the privilege of having Chris Leather, who's the director for N4D, as providing the opening remarks. After Chris, we are going to have a panel discussion between 4 speakers, which I will introduce in just a moment. And then we have the great honor of having Dr. Ghassan with us to give us our closing remarks. Once we complete on the hour of the session, please stay on to take the survey. The survey will pop up at the end on your screen. If you don't see the survey, please scan the QR code that is going to be flashed on your screen. It will only take a couple of minutes, I promise, but it's really important for the organizers. So kindly do that if you don't mind. So now I'd like to turn to our first speaker, Chris. Chris Leather is the director of N4D. He has over 30 years experience promoting the integration of nutrition into sectoral policies and programs. He has managed and supported nutrition programs and provided policy and strategic advice to governments, international organizations, and various countries. Colleagues, each of our speakers today has a very long bio, and I encourage you to look them up and find out all the wonderful things that they've done. I'm going to keep that very short so you can hear more from them. Chris, over to you, please.
Thank you very much. It's a pleasure to be here for this very important discussion. As Maysa said, I'm a director with N4D. We're an organization that works with national governments and other country stakeholders to support the development, resourcing, implementation of national multisectoral nutrition interventions, a critical element of early childhood development. And we currently have a major focus on protracted crisis contexts in Ethiopia, Niger, and Yemen, and work very closely with Karima, who you will hear from shortly. I'll keep my comments very short, as I think it's most important that we hear mostly from the people most directly impacted by and working in protracted crisis contexts. But I just wanted to cover four issues to frame the discussion. Firstly, sharing our observations on how the international aid system is currently responding to threats to early childhood development in protracted crisis situations. Secondly, what approach we think is needed to better promote and support early childhood development. What kind of reforms are needed within the international aid system? I'll highlight that we think it's not only about remodeling humanitarian response, we need a broader set of changes to how international support is provided. And then finally, just summing up in terms of why it is so critically important to invest in early childhood development, even in very complex, protracted crisis situations. So on the first of those points, while international aid has made vital contributions to early childhood development in crisis settings, for us, its limitations in these contexts are really quite clear. When crises stretch for many years, whether that's due to conflict, displacement, climate change, or other factors, the reality is that young children often become the invisible victims. Yet we know that during the first 5 years of life, or the first 5 years of life are really critical for a child's cognitive development. And without support, children can face irreversible setbacks to their health, to their nutrition, to learning, and to their emotional well-being. Yet, as Maysa highlighted a moment ago, early childhood development is rarely prioritized in humanitarian plans and budgets. International aid remains, because of the humanitarian focus, too short-term, too fragmented, and reactive. It's focused on survival and much less than on supporting the sustained developmental needs of young children. There's a lack of coordination across different sectors, across health, nutrition, education, that undermines a holistic approach to care. And local actors, local and national actors that are best placed to provide the culturally relevant support are way too often underfunded or sidelined, despite commitments around localization made as part of the grand bargain. So what approach do we want to see? Well, we need to shift away from these stopgap responses and move much more to longer term, holistic, child centered strategies that are locally led, more accountable, and developmentally focused from day one of crises. Early childhood development interventions need to be embedded within the 5 domains of a nurturing care approach: within health, within nutrition, learning, caregiving, and safety and security. And one critical element from our perspective is that these interventions in different sectors, they need to converge on the same at-risk children and families through an integrated, community-centered approach. The programs, they need to be community-led, they need to tap into local knowledge and support systems and be flexible enough to respond to the dynamic circumstances of protracted crises. And of course, a key priority is investing in local capacity, particularly training the frontline workers whose job it is to deliver nurturing care. So early childhood development, it's not a luxury. It is life-saving, of course, but also it builds resilience and protects the future of communities. So what kind of reforms are needed to enable this kind of approach? Then it must be embedded into humanitarian coordination mechanisms from the start to ensure multi-sectoral planning that links the interventions in different sectors. Early childhood development should be funded as a core component of emergency response, not an optional add-on. And local actors must be supported to equip themselves with flexible multi-year funding to deliver sustained, consistent support. But as I alluded to at the beginning, for us, reforms to humanitarian aid alone are not enough. The humanitarian system just isn't built or it is built for short-term relief. It's not built for longer-term transformational support that is needed for effective early childhood development. And as we know, humanitarian systems and responses often, despite goodwill and rhetoric to the alternative, they often bypass local systems, limiting their ability to provide and ensure sustained nurturing care. So whilst integrating early childhood development into humanitarian response is important, it's insufficient without a broader shift to what we might call a humanitarian development and peace nexus approach, which ensures coherence across sectors and timeframes and promotes the capacities and sustains the capacities of local and national institutions and systems. So just to pull that together and reflect on why it is so important to invest in early childhood development, even in the most difficult of circumstances. Failing to act has devastating long-term consequences for children, for caregivers and for societies as a whole. Investing in early childhood development is not only the right thing to do, it's the smart thing to do. Early childhood programs, we know from the evidence, they're cost effective, they can be high impact, they build resilience, they promote healing, and lay the foundation for lifelong learning, health, and productivity. So, in short, if we want to break the cycle of crisis and poverty, we have to start at the beginning of life. Integrating early childhood development interventions across humanitarian development and peace building responses to dramatically improve health, learning, resilience, and helping children, families, and communities heal, stabilize, and rebuild. I think that's enough from me. Thanks for this opportunity to frame the discussion and share our own observations. And now I'm really looking forward to hear from our colleagues working in the countries about their own practical realities, opportunities, challenges, and ways forward. Thanks very much.
Chris, thank you so much. You've set us up really well. Really appreciate your insights. Colleagues, now I'm going to move us to an engaging conversation with our fellow panelists. I will introduce them very briefly and then ask them each a question before we open up the opportunity to you ask the question. So please post your questions in the Q&A chat so that I can see them. First, I would like to introduce Karima. Karima Ahmed Al-Hada'a is the Planning and Liaison Specialist in the SUN Yemen Secretariat Ministry of Planning and International Cooperation. SUN stands for Scaling Up Nutrition Secretariat. She led the development process of Yemen's multi-sectoral nutrition plan, Yemen Action Plan on Wasting, and Yemen Nutrition for Growth commitments in 2021, and National Food Systems Transformation Pathways. Welcome, Karima. I would also like to introduce Wakil Fekri, who is in Afghanistan. He is the National ECD Advisor for the Aga Khan Foundation. He has a wealth of experience and education in the space. He has over 24 years of experience, both in education and early childhood development. We also have Marcela Masiarik, who is the head of cooperation with Yemen at the German Embassy in Sana'a. She's currently based in Amman. Since 2021, she's led Germany's development cooperation efforts in Yemen, focusing on humanitarian aid, peace building, and the empowerment of women through humanitarian development peace nexus. Welcome, everyone. I am also sad to say that we were meant to have a colleague from Ghassan, Ihab Aboued. Unfortunately, he is unable to join us because they have a blackout. If Ihab joins later, please prompt me so I can engage him. At the moment, I don't see him on the screen. Thank you, everyone, and welcome. If I could start with you, Karima, my question to you is, how effectively is early childhood development currently integrated into national humanitarian strategies, and what lessons have emerged from your experience?
Thank you so much, Maysa, and thank you for everyone participating in this webinar, also sharing us this concern for children around the world. As Chris highlighted, that the ECD is acknowledged in humanitarian strategies. However, unfortunately, at the implementation, it remains inconsistent and limited. This is mainly for challenges in policy and prioritization, because ECD is always, unfortunately, deprioritized, and not look at as preventive measures, with a huge focus on the humanitarian and life-saving actions, with all the impact of the humanitarian actions that we have seen in many crisis settings. And I'm speaking now on behalf of Yemen, but also I believe that I'm also describing this goes to many other contexts like Yemen, where even after almost 15 years of humanitarian response and actions, we have almost more than 4.5 million children out of schools, and we have almost 2.7 million children suffering from malnutrition, wasting and stunting, and different forms of malnutrition. And I can remember, and I can also share with all of you why the ECD elements, like education, for example, is deprioritized when we were developing the action plan on wasting. And we included actions for education. We have asked several times to take them out. And we were asked several times, are they priority actions? So our answer was that yes, because education doesn't wait. However, I think the challenge is rooted in the approach and also the modality of humanitarian response. Having two parallel systems, the government system as the resilience and also development, and also have the other humanitarian structure. Parallel systems were not working together and also not completing each other, focusing on short term activities and also short term provision of actions with no connections to long term impact of these interventions will definitely have these results that they will not last, and also with a very weak impact on children. So on the other hand, for the integration of the ECD, we, during the update of the multi-sectoral nutrition action plan, we focused on the ECD elements. However, identifying these interventions was a huge challenge for us, because when you look at the evidence-based documents, it is linked to different elements. Always we will have these limitations with the focus on the elements of ECD and including them in the policies in humanitarian settings. That's why we believe that the humanitarian development peace nexus is one of the most important approaches to prioritize ECD, and also to work or to reduce the parallelism between the structures inside the countries. The other point that I would like to highlight, that the ECD as activities and for our long-term impactful actions, they need to be provided through the local and national systems. This means that the government institutions, schools, hospitals, and other institutions, they should be supported, empowered, and enabled to provide these services. This is how we will ensure having long-term sustainable interventions for children. Providing these elements of the ECD, or the different in education, in health, in social protection, all of these actions, if they are not embedded into the policies and the national plans, if they're not embedded into the the institutions of the government, the provision of these interventions will stay very weak and limited. So the lessons learned that we can share with all of you, enabling and empowering government institutions is crucial and will leverage and scale up the ECD interventions and also the long-term analysis and the long-term provision of these interventions will also have this impactful actions for the children. All the stakeholders also to have joint actions means that we need really to work through joint systems and joint structures. Thank you so much.
Thank you so much. You covered so many different points there. I'm sure the other speakers will pick up on them as well. Thank you, Karima. I'll come back to you. Wakil, let me move to you now and ask you, how can cross-sector collaboration between health and education be strengthened to improve outcomes for young children who are living through crises?
Thank you, Maysa. As you know, in Afghanistan, we moved through a 5 decade of war. And in these 5 decades, we have faced different government system and policy in place for the education and health, and also for the children. And our Khan Foundation in this unstable government system, and this unstable government system recognized the importance of focusing more in the communities instead of the working with the government, and to focus more in the community, that our Khan Foundation aim to that all children have access to 5 components of the nurturing care framework: good health, adequate nutrition, responsive caregiving, opportunity for early learning, and safety and security. And we have moved to the community with a strong multi-input intervention in the community to focus on children from 0 to 6 years of old, and also parents and caregiver, adolescent girls, and also health facilities and community elders to ensure that the children have a good start in life. And for this, we have worked as a cross-sector collaboration between health and education. We worked in the health facilities and to establish ECD corner in the health facilities, where the parents have opportunity to come and visit there. And we also implemented the care for child development. Their care for child development approach in the health facilities. And we also focused, we had a lot of opportunities in the communities where the pupil is more responsive, and we have developed, we have established pre-primary classes for the children of 4 to 6 years of old. And also we have established community library for the parents and caregiver to have access to the different books of the health and nutrition and also responsive caregiving. And we focus it on this whole approach to focus on the health facility in the community and school. We have also worked with the school education system to ensure that the children, after the ECD intervention, they come to school and they start a good education there at the school. And this all of this component of the nurturing care framework, we have focused to ensure that the children have access to 5 components, and we bring for them a good start for life. Thank you.
Thank you very much, Wakil. I will also come back to you. I'm sure also our participants would love to know more. And now if I can move to Marcela and ask you, please, what role should international donors and partners play in supporting sustainable government-led ECD initiatives in humanitarian settings?
Thank you very much, Maysa. The question is very easy, but so difficult to put it in practice. And this is where we are. This is exactly the situation where we are. We are talking about early childhood development. Do we have to talk about this? I mean, where is the future of a country if we are not focusing on the children from the very, very, very beginning? Where is the future? I'm working in Yemen. Where is the future of Yemen? Where, like Karima said, 6 million, I mean, it's almost the whole next generation. So it is more about doing than about talking, because we were talking about this a long time. And the same we are talking about the role of the donors and of the international community, and the same we are talking since at least 2016 about coordination between the different parts of the international engagement. Because it is not a humanitarian, it's not about the reform of humanitarian system. It's about thinking in the whole picture. And we're talking about the crisis. So when we have a crisis, and we see just now in the recent days, what is the international community doing? Sitting together and trying to find a way how to work together. So there is no way to go bilaterally to become visible. It is only about how to work together to make the joint work effective on the ground so that we can change something. This is what Chris said already, Karima said already. There is no way beyond the humanitarian development peace building coordination, and the donors have the key role because it has to start on the strategic level. And this is where I'm joining all the meetings on humanitarian development peace building. There are never donors attending this. And when I say I am on the ground, I am going everywhere, it is something like the people don't understand because it's not the role of the donor. I think it is. We have to know the situation. We have to understand, and we have to plan the budget in a way that it can be coordinated. Because what do you want to coordinate if you didn't coordinate it strategically at the beginning? So the donors are key in this process. And we have so many processes on HDP Next. It's just necessary to start working on it. And the same is also for the sectorial. You can't look at water without thinking about health. It is just not possible. And the children will remain the highest priority.
Thank you so much, Marcela. Unfortunately, I don't see Ihab. I don't think he's been able to join us. So allow me to ask you to start with you, Marcela, on a question that's actually popped into the Q&A. And for the participants, please do post your questions on the Q&A board. I'm going to pick them up as I can. So one of the colleagues who is an anonymous attendee is basically saying, those of us who are engaged in the ECD space are always sending the same messages. We need to be unified, the importance of ECD, but in practice, this is not really happening. What is your advice on how can we get ourselves truly walking the talk? Is it really a question of coordinating our advocacy as global funders, or is it really time to move the approach to and put the funding behind domestic funding? I think this is what the question is about.
I think we are still in between because of the difficult context, the crisis, where the donors are very hesitated to invest. But you have the same situation on the implementing partners level. They are afraid. I know that they are communicating, but not that much that they should do, because they are afraid if they would criticize something, they would not get money. So there is something very, very wrong in the whole system. And I think the starting point is we have to think together how we can improve the situation and stop thinking bilateral, how we become visible in what we are doing. So this is, I think, key way to achieve something, and we need the voices, but we also need the voice from the government. Like in Yemen, I mean, we started to work on the system on HDP coordination, but the government also has to be very clear, and the government has to role very clear, saying the donors, please, the children are our future, and you have to include them. You have to. They have the possibility, and they should.
So part of the answer comes from the governments and local actors themselves. They need to say this is a priority over other things in their partnerships with aid agencies. That is clear. Karima or Wakil, would you like to comment on this point? Any further thoughts on how we move from the echo chambers to actual prioritization of ECD between donors and governments? Is there any place that you think, from your experience, where that has worked well?
Maybe I can start, Maysa, from my side.
Thank you.
It's always very important for the national actors to be clear about the vision, where they want to go. So if we don't have a clear vision, if we don't have a clear long-term vision, I don't think it will be easy for the partners, whether they were donors, as Marcela said, or national actors, how they can, collaborate and work together. And that's why we need to think at each context, how we can, agree on this. And it is easy to agree on the vision, but it will be not that easy to agree on the way of working. So again, I put the responsibility on the governments, to be honest, because they need to work very clearly on the way of working to set the rules and responsibilities, and also, to support the different sectors to identify the rules in supporting the early childhood development. Because most of them are in health, education, but we have others in other sectors. They need to be clear, identified. Of course, I think in Yemen we used to have a joint action plan that was even, maybe 20 years ago. But now the early childhood development is not there. Why? Because they don't think it is priority. They think that, responding to stunting, wasting is priority. But actually, everything, all the elements of the early childhood development are the preventive of the malnutrition in Yemen. Working on the preventive actions is the right solution at the countries. And the integration, it means that each sector needs to understand their rules, identify them, put them inside their action plans, and mobilize by themselves. No one can from outside the country can mobilize for the country. Each sector needs to mobilize resources for themselves. They need to convince others to partner with them. Of course, the government at the national level should support these initiatives, should, be the platform where all these sectors meet together, agree, and also collaborate. Thank you.
So very much a coordinated, nationally led effort. Thank you. Wakil, please.
Yes, thank you. As I mentioned previously, that in Afghanistan, we face the unstable government system, and this unstable government system and policy, and each time with a new government regime came, they have less knowledge on the early childhood development, and for this reason, they don't focus more on ECD, which is a very important. And with the previous regime, Aga Khan Foundation was working with the other different implementing partners and also in donors together. We have established an ECD working group, and in the ECD working group, the ECD experts from the Khan Foundation, from the UNICEF, from the Save the Children, and other important agencies. And also we have involved the different sectors from the government side, Ministry of Education, Ministry of Public Health, and Ministry of Labor and Social Affairs to work together, and we have developed a joint planning to work together in close collaboration, and also we had our monthly coordination meeting between these all sectors, and also the donors and implementing partners, to ensure that ECD is recognized as an importance from the government side, and to ensure that we have enough funding for the children in the country. Thank you.
Thank you very much. That's heartening to know that you have a coordinated approach and trying to bring all actors together and having an ECD working group. Of course, that's critical to coordination. It doesn't necessarily mean, however, that donors are prioritizing funding ECD. And I see some of the comments in that there are questions and there are also comments, and please feel free to add your questions to the Q&A. One of the questions is, given the funding cuts, they specifically mention USAID, but obviously it goes beyond that, and cuts to critical essentials like food rations. How do communities and local actors and nonprofit organizations ensure that donors, we're not just talking about governments, all types of donors, see that ECD is a priority in situations where there are sort of the most basic essentials are running short? What are some of your experiences in that, and how do you draw the line between the needs of the youngest children and the overall needs of the population, particularly when the situation is dire? We just heard the head of OCHA talking about the restructuring of aid, resetting of aid, and talking about needing to do less with less, essentially. So how do you prioritize ECD in that context? Marcela, can I come to you?
Yes, thank you. I was thinking about it when you were talking. You said at the beginning the topic is close to your heart. It should be to everybody. I mean, I still think about how to make it clear to everybody how important it is, that it is necessary to make it clear. This is still my question. How is it possible that it's necessary to make it clear? So my observation is, if it is necessary to make it clear, then the people need clear pictures, like what Karima was saying, to really to mobilize or to make the people wake them up about exactly this issue. The one issue is the food security and the conflict crisis, which is such a huge priority, the highest priority for now. Economy, of course, but it is starting with the generation, a new generation. So if there is no awareness about this, I don't think that our local partners, who are the most and the strongest partners on the ground working on it, will be able to make it, to build up the awareness. It has to be done, yes, by the, if possible, by the government, or making very clear, presenting to the donor community very clear how is the situation and why there is no way around this. Because if the awareness is still like this, that you always get some proposals about this is important, then the focus is definitely not there. And it has to be. This is the same like the climate change. If you start to say that climate is a problem, then everybody will think about climate projects without thinking that it is part of the whole picture. So to think it holistic is a problem, and that is the awareness that we need so much. And I think very clear pictures speak a very good language.
Thank you. So I guess we have to also learn to communicate more effectively and strongly and in a unified voice around the needs of children, and ensuring that in our efforts we're not derailed by lack of coordination and over messaging and over indexing. Thank you for that. I couldn't agree more. There's a question for Wakil specifically. Wakil, one of the participants, Nasia, is asking, she's really curious as to how the future of ECD is looking like in Afghanistan, and what have been some of the successes of the coordinated efforts that you've spoken about.
Thank you. Currently, we have faced the government, and you understand that we face a lot of restrictions on the women and the women that cannot work freely, and they cannot travel there. I think that the participant that has this knowledge about this, the Afghanistan, which is there are a lot of the restrictions on the women, but we have worked to manage somehow, and we have changed our approach here in Afghanistan to ensure that we reach to the children, and also the women. The girls can have access to the ECD intervention in the classes. And for this, we changed our intervention a lot since the previous regime. For example, in the previous regime, we have managed to train the teachers all together in one place, but right now it is not possible. We changed our approach, and we shifted the training to close to their homes, where they don't this much travel, and we are not they don't face any issue from the government side, which is the restriction on the women there. And we have also changed a lot of our approach to make sure that the children, adolescent girls, parents, caregivers, all of them have access to the ECD centers. Thank you.
Thank you very much. That's heartening to know. One of our participants, Suzanne, is making a plea to prioritize or at least put the spotlight on children with disabilities. And she cites Gaza as a primary example, given the percentage that Gaza now has the highest percentage of child amputees in the world. Do any of our esteemed speakers have experience or any comments that they'd like to make about how to prioritize and integrate children with disabilities, particularly in war zones, and what experiences might you have to share in this area? Karima, would you like to comment on this, or anyone else?
Yes. Yes. Actually, I raised my hand. Unfortunately, on ground, we see that always children with special needs and also with disabilities, always they are deprioritized. And actions, for them also, we can see them on board, on policies or action. And you can look at the HRP, for example, in any country and see what are the direct interventions for them. From my perspective, looking at the context in Yemen, I believe that we have several institutions and, schools and hospitals and, organizations for these different types of, disabilities for children, but they are not supported. So the shortest way to support people, children with disabilities and special needs, is to go to these public institutions, support them, because the other ones, the private ones, are very expensive, and usually, children with disabilities are with poor families that they can't go to private institutions. So public institutions should be supported, should be they build the capacities of the service providers and also the different elements inside this. And it could be health facilities, it could be schools, it could be organizations and institutions that they train or provide any different types of services for children. Thank you.
Thank you very much. Marcela, can I give you the floor for a minute, and then I'm going to introduce our esteemed closing speaker for the closing remarks. The time has flown by. Please go ahead.
Yeah, I don't want to talk long. I just wanted to say that this is an issue that we should be very careful about, because we are not allowed to create additional problems in the civil society that are already there. All the countries have so many problems, and we are not allowed to create additional ones. Children are children, and that has to be thought in one. We are supporting children, and one of them need more support, but they have to be part of this. It is the same like the issue with the displaced people. These are all, when I'm talking about Yemen, Yemenis. So if you just start to separate them, split them, then we are already from outside creating additional problems in the civil society. We have to think about children with or without disabilities together.
Thank you for that. Our colleagues from the Moving Minds Alliance are reminding us that the next webinar is actually focused on children with disabilities in crisis settings. So for those who are interested, I encourage you to sign up. And now for the last few minutes of our webinar together, I'm going to invite Dr. Ghassan, who is a community pediatrician and has been the general coordinator of the Arab Network for Early Childhood and the general coordinator of the Arab Resource Collective, which promotes a better childhood health for all and community development in the Arab region. Dr. Ghassan, if I could please invite you to summarize and reflect, given your wealth of experience in a region that is unfortunately suffering from millions of children being affected by crises. Would invite you, please, to share your comments.
Thank you, Maysa, and thanks to MMA and all the speakers. Nothing much to add. I think the experience that was given today is tremendous, and it all reflects what's happening in the field. Thank you all for your insights, enthusiasm, and dedication to transforming the lives of our children facing crises. As we conclude, sorry, I had a problem with okay. As we conclude this session, I want to revisit a truth we have explored throughout. In a humanitarian crisis, the survival of young children is merely the beginning. For millions of young children trapped in the grip of war, displacement, and systemic collapse from Gaza and Yemen to Sudan, Syria, Afghanistan, and Lebanon, getting through the day is just the first step. What follows is a lifelong struggle to thrive in environments that frequently overlook their potential, needs, and rights, which is very important. What we have heard today paints a sobering picture during prolonged emergencies. ECD is consistently overlooked, fragmented, and underfunded. However, we have also learned that this is not merely about isolated humanitarian emergencies. We are encountering a world of polycrisis, where conflict, displacement, climate breakdown, economic volatility, and pandemics intersect and amplify one another. Because a human crisis is a large-scale emergency that threatens the lives and well-beings of people, whereas the polycrisis is the situation in which multiple interconnected crises co-occur, intensifying the impact of each on the other. In a polycrisis, a humanitarian crisis can be exacerbated and made more challenging to address. During these overriding crises, the youngest children become the most vulnerable and least visible. However, the evidence is clear. The early years are not a luxury in emergencies, they are a lifeline. When we neglect to invest in young children, we are not simply delaying development, we are exacerbating cycles of trauma, poverty, and instability. However, we also heard a call for change, and this is a way forward. There is a way forward, and it starts with a shift of mindset. ECD is not secondary to humanitarian responses. It is the foundation of resilience, healing, and rebuilding. This is our moment to move ECD from the margins to the core of a humanitarian action, to stop asking whether we can afford to invest in young children in emergencies and start asking how we can afford not to invest. Let today be more than just a conversation. Let it serve as a call to leadership, partnership, and courage. This involves rethinking the international aid system by integrating ECD into coordination mechanisms and connecting health, nutrition, learning, and protection in a coherent, child-centered approach. This should signify the end of isolated and short-term responses. Governments should be empowered to lead ECD strategies that are locally grounded, resilient, and sustainable. The message is clear yet urgent. The way forward is not just technical, it is transformational. We cannot afford to repeat what we have been saying for decades. We can like vocabulary like enable, empower, strengthen, collaboration, enhance outcomes. And we need to start putting into action the following. Fund strategically, not just on a project to project and limited time basis. Fund partnerships to stop competition for funding. Stop silo approaches, starting from the top, UN agencies and international NGOs. Contextualize, not localize. This is a community-driven, culturally relevant, and regionally based strategic approach, rather than one that is overly local. Humanitarian responses should serve as entry points to polycrises. In the beginning, I said that survival of young children is just the beginning, but our children need to survive first. So stop all wars on children now. Thank you.
Thank you very much. Not much else to say. That was beautifully worded. Thank you to the organizers, to the speakers, to the participants. Please join the next webinar, and I would kindly invite you to please fill out the survey. It only takes just a moment of your time. Colleagues, thank you for the important work that you do.
Thank you very much.
Thank you.
Thank you.
Thank you all.